This is where we kind of finished last time. I mean, we were coming in hot last time. We had a lot of questions and discussion. I want to make sure we covered this information. Does anyone have questions about this part of our uterine tubes? They're muscular, so they undergo peristaltic to move toward the uterus. They're cilia, and you can see some of the cells are ciliated, some are not, in the uterine tube. And we're going to see these play a role in the final activation of the spermatozoa, which are the released sperm. That's their final name. But they're not ready to fertilize yet. That happens in the female reproductive tract. Yeah, and these are our layers. Where did we say fertilization has to take place if you're going to get a successful pregnancy? It's going to be in the ampulla. This is the ampulla, but it's going to be closer to the end. This enlarged kind of funnel head, that's referred to as the infundibulum. Do you remember the names of these little finger-like processes? The fimbria? You saw it over here, didn't you? No, I'm serious. Good. The fimbria. And again, those are going to be covering over this portion, again, keeping this current moving in this direction. So once the oocyte, zona pellucida, corona radiata complex, I wish there was a name for that unit, but it's like the spaceship that the oocyte lives in comes out, and it's going to move into the fallopian tube. And fertilization must occur in this portion to develop to the right stage to be able to implant in the uterus.
So the start of the ampulla.
The beginning of the ampulla, or fertilization in the ampulla. Okay. Now in the uterus, it's kind of interesting. What did we call the domed superior portion of the stomach? The fundus, because it's fun to say, right? It's fun to say. Guess what? You got a fundus here, the superior dome-shaped part of the uterus. Now, you probably understand that the uterus is a highly muscular organ. And in fact, there are, let's see, where was it? 3 layers of muscle to this thing. So we've already talked about this is a place for implantation of the zygote. This is going to protect and nourish the embryo. And in fact, a portion of the placenta that is made in this protection, you're not protecting the fetus necessarily from the outside environment, you're protecting the fetus from the mother. Because the mother's immune system probably would attack and get the baby out of the way if not for some of these cellular and molecular tricks that the fetal portion of the placenta does. So if there is an organism that tricks its host into not getting rid of it while it's draining the nutrients and the supply from the host, what do we call this organism? A parasite. I think I might have said that at the beginning of the semester. You people are parasites. I was not a parasite. My mother loved me. No, I'm kidding. No, they're literally, I mean literally parasites that we love and we care for, and sometimes we care for you until you're 40 and 50. But you know, that was supposed to be funny. Huh?
What you trying to say?
My wallet is getting really skinny back here. Some of those basement dwellers. Now, we've got at least 2 moms in here that understand that another function of the uterus is to eject the fetus at birth. I think that is a mild way to discuss that process. A comedian one time talked about his wife giving birth, and the doctor was just sitting on a stool down kind of at the back of the table. He said he looked like a baseball catcher just waiting for the pitcher to throw the ball. I don't think the baby shoots out like that, but that's the part of the uterus. Now, sometimes the contractions that have to be regulated by hormones. Do you remember the hormone we talked about in the endocrine system that starts the uterine contractions? Oxytocin, right? Sometimes those hormones aren't at a level enough and the uterus doesn't respond. Sometimes the membranes break, the amniotic fluid that the baby is safely in ruptures. Now you've started a clock of about 24 hours that you have to deliver the baby. So there are artificial hormones called Pitocin that can stimulate the contractions and put you into labor. And you said it sucks?
Yes.
Okay. So they gradually increase the level of the Pitocin. Not gradually. The baby did shoot across the room, or?
Pretty much. No. It was like, as soon as you get it, it's like immediate, like the worst cramps you've ever had in your life. And they don't stop until they turn that little dial off. It is, until you're at 10 centimeters.
Just say that again. It's
It's awful.
Aren't y'all so excited about being parents someday?
Great drugs though.
Say that next part again. Everybody needs to hear.
They've got great drugs though.
Okay.
They do. And TVs.
Guys, they don't give us anything.
They don't need nothing. What? Y'all get to eat whatever you want. We don't get to eat.
Okay, moving right along. Now, the other lovely thing that you females of the species get to enjoy is if you're not pregnant, you get to go through the monthly shedding of the uterine lining.
Is it really enjoyable?
Is that what causes? He said it was small.
Do what?
Isn't that a part of our cycle where we like have minor contractions and that's what like causes something?
Do you have minor contractions at the point of your menses? You do experience that?
That's the cramping.
Okay, that's
Yeah,
what I thought.
yeah.
it's just a
Because you're trying to express and get that. Oh, it's not the same thing.
I mean, but like to an extent.
Okay, so the cramps, okay, wait. Okay, the cramps that you have monthly, compare those to your contractions you have in labor. Is there any?
So yes, sometimes when you have like a really bad month and you're like if you're like walking and you're like it's that's comparable, but like other than that, no.
No.
If you're on Pitocin
Okay, yeah.
or if you're on
Okay, let's move along. All right. So we've got the dome-shaped fundus, just like the fundus of the stomach, superior, the body of the stomach. The isthmus is kind of a connecting region, and that's what that term somewhat means. And then here at the bottom of the uterus, which is sort of the cap or the superior part of the vagina, this is where we have the cervix. And then the opening of the cervix is called the os, the os of the cervix. And during your labor, this is what the doctors are checking to see if it is dilated. All right? Take a deep breath. Fully dilated, this little hole right here, fully dilated, 10 centimeters. 10 centimeters. All right? How large is it normally? Like, I mean,
Like this
yeah,
big.
So, needless to say, there's some elastic fibers built into the connective tissue here. All right, now the myometrium, the middle layer of the uterus, that's the muscular layer with those three differentially arranged fibers, because this thing's got to three-dimensionally contract to squeeze out the baby. And the uterus can contract so hard that it becomes detrimental to the baby. In my first daughter, she had to be induced, and just she was not going to fit through the Oz. Okay, she was not going to follow the yellow brick road. But as being induced, the contractions were so hard, her heart rate started to decrease during a strong contraction. The OBs called that a deceleration, and so they stopped the Pitocin to allow the baby to rest, that it was really stressing the baby. So just something to to be aware of. It's not uncommon. You can imagine if you're getting squeezed inside a straitjacket that covers your face and head and everything, it's going to be stressful to you too.
What does high blood pressure do with like your baby?
When you, the mother, have high blood pressure, I believe the condition that it can cause is called preeclampsia, and that can actually cause premature detachment of the placenta. So that's the real risk of having high blood pressure and hypertension during pregnancy, the preeclampsia.
But help also, HELP.
I don't know what that is.
So it's like a step above preeclampsia. And there was a patient in the hospital a few years ago that she was younger. She had preeclampsia that turned into eclampsia, I guess, or whatever. And then above that is HELP, and she basically is a vegetable afterwards.
Oh no, the mom?
It was awful. She didn't.
Ooh. Okay, don't ever look up things that go wrong in pregnancy when you're pregnant. Ladies, just tell. I teach developmental biology, and the book is full of these horrific congenital birth defects. Normal babies are born in the thousands every single day, okay? Don't go thinking that that's going to happen to your baby. You will go nuts, all right? So we've got our 3 layers. The outside layer, the serosa, is called the perimetrium, peri meaning around the periphery. The endometrium inside, this is the real functional layer of the uterus for implantation, producing a part of the placenta and nourishing the baby. We've got the myometrium you can see here, and the endometrium consists of the basal replicative, or they call this the germinal layer that reproduces every month, and then the part that is shed or that becomes the placenta and nourishes the baby is called the functional layer or the functionalis. And within the functional layer, you have spiraling arteries, you also have the veins, and then you have uterine glands that are going to provide nutrients to the early developing zygote embryo until it can fully build the placenta and be nourished through the umbilical cord that way. Now, the uterine cycle, we talked about the hormones involved. This just breaks it down into the 3 stages, the menstrual stage, and they start the cycle in this particular instance at day 1. That is the shedding of the functionalis layer. So there wasn't a successful implantation in this case. Then we have the proliferative, or we're regrowing, and notice that's in the end of the first week into the second week. Now we're growing the new functional layer because it's going to be in the middle when we're going to have ovulation. Yeah, it's going to be here, where are we here? The proliferative phase, kind of in the middle of the cycle, so 28-day cycle, so day 14 is in the middle. Somewhere in there, a day or 2 difference, you have ovulation. Then we're going to see you got 24 hours to fertilize the egg in the ampulla to get implantation, maybe down here in day 21, 23. All right? And then lastly, the secretory phase. This is going to be the end of the cycle. You're increasing the vessels, you're increasing the glands, being prepared for implantation. Then if you don't get the right signals, if estrogen and progesterone drop, then that's when you shed and you start to do it all over again. Yeah.
The implantation happens in the secretory phase or during ovulation, or ideally?
So ovulation happens, we'll say in the middle, day 14, right? You got 24 hours to fertilize. Then the zygote is going to take about 6 to 8 days coming down the tube to be at the right stage to implant.
Okay, I understand.
Yeah. And when you think about that timing, you wonder how it ever works, but clearly it works pretty well. There's a lot of us running around.
So like, can certain hormone therapies or hormone like conditions like cause a off-put uterine cycle?
Well, for one thing, if there's a problem with the cycle, and again, I go back to PCOS, that will throw your hormone cycles off horrifically. The gynecologists and obstetricians, they will put you on hormone replacements, birth control pills, which are hormones, to try to regulate your cycle. The other thing that will happen with a sort of severe PCOS and moving into infertility is they will give you regular injections. They will give you follicle stimulating hormone. You'll take those, I think, daily. And then towards the middle of the cycle, you get this big honking luteinizing hormone to make you ovulate. So they'll try to regulate it that way if they can't do it orally with medication.
I have friends that have gotten like an IUD and they have a period like all the time. How does that work?
They bleed all the time.
Yeah, I had a friend, she bled for 2 months straight.
Now, was that when she first got it?
No, it was like on and off throughout it.
I would have to wonder with anything implanted like that if there was something irritating where it was positioned, and it wasn't actually the shedding of the functional layer, but it was just bleeding. Yeah, that IUD is intrauterine device. Yeah. So I would. Has she gone and had it checked out at the doctor? The doctor said it was fine.
But you can just continue to have periods.
So
Okay, that doesn't sound fun.
that's also kind of what happened with me. I just got my birth control removed, but I have extremely regular cycles, and then with the birth control, it placed me off balance, and so I had a period for like 2 months. 2 months.
See, like, what
Never
even,
stopped.
how are
You
you?
don't have one for 7 months? Oh, you're pregnant.
No, I don't think I'm pregnant, but
No, no, no.
I went from that.
Well,
Like, how does that
if you haven't had one in a number of months, then you may want to, and if that happens frequently, you might want to see a gynecologist.
some birth control that's normal?
To not,
normal, like
Some birth control stops your period.
oh, you're on birth control though. Oh, duh. Tell me that up front. Yeah.
That's all the birth control. It's
I'm not assuming. Yeah. All right. We good with the uterus, the uterine lining? All right. Then we've already talked about this implantation that stops the cycle, and you do not shed the functional layer. Otherwise, you would be throwing the baby out with the bathwater, literally. All right. And we don't want to do that. All right. So now we're literally coming, well, I don't know if this is the end or the beginning of the female reproductive tract, but now we're leaving the cervix, again, which is the superior sort of end of the vagina. That's going to sound funny on that tape. I almost dropped my remote. I wasn't giggling. I told y'all not to giggle. All right. So the vagina is a fibromuscular tube, on average 2 to 4 inches in depth, but during arousal it can expand to accommodate 4 to 8 inches. And when you think about the design and the composition of the vaginal wall, it should not be surprised to anyone that the adventitia, the outer covering, has a large amount of elastic fibers. What do we say, 10 centimeters? This thing has to stretch. And when you look inside the vagina here at the epithelium that lines the vagina, it's going to be folded because it has to stretch. Yeah, this is a scanning electron micrograph of the ridges that you see lining the vagina.
Are they rugae?
Well, I don't think they're called rugae necessarily. I think the rugae, that may be a term specific for the stomach, but you know the folds in the stomach has to expand a lot. So when it's not full, you see the folds. Well, these folds have to be there, and not necessarily for sexual intercourse to expand, but for this watermelon that's coming out.
all right now. Don't
So-
call your baby a watermelon.
I call my baby a lot of different things. Now, here is one of the reasons when we get to the male reproductive, that the male reproductive system has the glands in place that it does, including the prostate gland. Because in the female reproductive system, there's going to be glands that produce an acidic secretion that prevents infection. Now, the vagina is open basically to the outside environment. And so there's a lot of nasties that can get in there. Plus, the vagina is going to be warm and moist. It is a great place to grow stuff you don't want growing. And so you produce this acidic sort of mucus secretion to prevent infections, or at least as much as possible. It's going to happen from time to time, especially if you're on antibiotics. That is the worst time in the world, because they're going to knock that down, and you're probably going to end up with a yeast infection.
Why can antibiotics like cancel out your birth control? I know a lot of people have got pregnant while they're on
I've never heard that before.
They say like you have to know that this cancels out your birth control. They have to tell you.
That happened to your grandma? Well, that's how you're here, right? If your mother didn't get here, then
My mom is her younger sister.
I did not know that. So everybody got that? If you're on birth control and you take antibiotics, make sure you know what's happening, or just keep him away. Just tell him stay away. If you're on antibiotics, just keep him away.
For all of you on antibiotics, ask for diflucan.
Diflucan? As long as you're not allergic to it. Yeah, probably is.
Infections away.
Question, sorry.
Oh, I wanted to ask this last slide, but for trans people, like female to male, when they're on hormone replacement therapy and are like taking testosterone injections, eventually they stop having the periods. So I wanted to ask, like, how does that work? Why is that?
So when we get to the male reproductive system, that's when we're going to come up with testosterone. So can you hold that question until we get there? Because women do take testosterone. Even biological women, not trans, but biological women do take testosterone. And you produce testosterone, just a lot less than what men do. And men actually produce follicle stimulating hormone and luteinizing hormone. You're going to freak out in the next couple of slides. If you previewed them, okay, you're a little prepared, but. All right. Now, also to protect the opening of the vagina, especially in adolescents and young women, if there has been nothing that has penetrated the vagina, whether it's a doctor examination or whatever you can think of, there is a covering over the inferior end, and it's called the hymen. And you may be thinking, number one, how did it get there? How did this drumhead essentially get over the opening of the vagina? So this next slide is going to go back to development just a bit. So during development, and now we have gone into the female gender pathway. And what we see is that first, we have what is called the urogenital sinus. It is a solid column of tissue. And that solid column of tissue is going to expand and go deeper and deeper and deeper as you're developing the reproductive organs. And it's going to begin to hollow out. The cells inside the center of this column of tissue undergo programmed cell death. Do you know the other name for programmed cell death? Apoptosis. That's how you say it to learn how to spell it, but it's apoptosis. Apoptosis. But I say apop, so I remember that silent P is in there. So apoptosis, programmed cell death, hollows out the vagina, the opening of the cervix, the uterus, that's all going to hollow out. But the very end of this solid column of tissue does not undergo apoptosis, and it remains as the hymen. So that's how that came to be. You hollow everything else out except the lid covering up the entrance to the future vagina.
The hymen is like the labia.
No. The hymen, imagine this is a tube. Imagine the female reproductive tract from vagina to uterus is a solid column of tissue. The middle of that's going to go away, but you leave the cap on the end. That cap on the end is the hymen. It's a membranous cap. I'm not going to be able to put this on YouTube. I have to click a button that says, "Is this for kids?" and I click yes. Today I won't.
Say
And I'm going to have to get y'all to sign waivers.
Say it's for educational purposes only. Say
Okay,
it right now.
it's for educational purposes only. I'm going to delete that part. All right. Now, what's going to be really, really surprising is when we get to this next part, because when you look at development of our reproductive systems, you do know that the ovaries that are abdominal for females, in males, the testes start abdominal. And well, remember the default pathway is female. And so the tissue that's going to make the ovaries and the testes come from the same place. And what happens, they have to drop through the inguinal canal and go into the scrotum. And if you, okay, we'll get there. We'll get there. We got to finish out the female part. But ovaries and testes start as the same tissue. It's called the indifferent gonadal period of development. And you got to have the right signals to shut off the female reproductive stuff. That's the chairman of the department. I told him y'all were asking a whole lot of questions. He said, "What are y'all talking about?" I said, "Reproduction." He goes, "Oh, okay." All right. So this might blow your mind. Not only is there an indifferent gonadal period, there is an indifferent genital period. That's why if you're just using an ultrasound, you can't tell the gender of the baby until safely about 20 weeks of gestation. Full term is 40 weeks, according to obstetricians. All right, we know it's 9 months and 40 weeks is more than 9 months, but how they do it based on your last missed period. But I want you to notice that you begin in this indifferent period, and that is what a boy/girl looks like, boy/girl looks like. And the tissue, depending on the signals that happen, here we get the signal, this is the default pathway to become female. And you can see we get the female genitalia. Now pay attention to where the same colors end up. Because if we get the signals to be male, so what we're going to see with female genitalia and male genitalia, it's as simple as this. Ladies, y'all forgot to zip up. The males just zipped up. Because, I mean, when you look, and we're going to get to the female genitalia here in a minute, but when you look at the labia majora in green, those are going to become the scrotum in males. And when we talk about male genitalia, you're going to see that on the scrotum there is a line right there called the scrotal raphe. It's the zipper mark, where basically the tissue that was going to make the labia majora came together and fused and zipped up. The labia minora, that's going to basically become the shaft of the penis and part of the inside of the penis. And where we have these cavernous columns that are going to be the erectile tissue, you're going to see them in your genitalia in the next slide. And then the glans penis that becomes the head of the penis, that's going to become your clitoris. So the stuff is the same stuff. It's just in different places and either unzipped or zipped.
So we're the same.
Just zip. Yeah. No, see, females are the default, so
How was there Adam before there was Eve?
you're going to have to take that up with him. I don't know. The default pathway,
That's the chicken or the egg.
maybe males were the beta test, and he was like, "Oh, no, that didn't work. Let's try this."
I was the rest of
No. Yeah.
Did Adam have a belly button?
Okay, y'all stop. Y'all stop.
It's a valid.
Did Adam have a belly button?
I don't
Yeah, he
think.
came from God.
Okay, sand.
Wait, is God a
Okay, let's just keep going here. Y'all asking me questions I cannot possibly answer. Okay. All right.
Wait, question. Are those legs?
Yeah, those are the legs
Okay,
of the
I was
person.
like,
All right. So we saw the starting material and where it ends up. So let's just make sure we understand that looking at the female genitalia, you have the mons pubis, which is going to be, I don't know if you call that superior or ventral. Okay, it's going to be right there over your pelvic bone, the mons pubis. You have the outer folds, which are the labia majora. You have the inside, more fleshy folds that are the labia minora. You can see the opening of the vagina, and you have the opening of the urethra. And all of this that is enclosed by the labia minora is called the vaginal vestibule. Now, I don't know what, the only place where have you heard that term vestibule before? I've only ever heard it in church. It's like, it's like a lobby or a space that's got a lot of doors off of it. And so you've got two openings if you're in that space covered by the labia minora. It's either the urethral opening or the vaginal opening. Now, in the tissue of the labia and the genitalia, there's going to be a number of sweat glands, sebaceous glands, mucus glands. Some of these, again, are going to be that chemical defense against infection. Some of the lubrication is going to be for arousal during intercourse. Okay?
What is that from? Sorry.
These secretions. And so all of these sort of come together and function as protection. The labia cover over the opening, again, trying to prevent infection. You got the secretions trying to prevent infection. And then when we look at the sexual reproductive aspect of the genitalia, you remember I said we came from the same stuff? The same stuff just got moved into different places. So when you look at a female genitalia, you have a number of different erectile and sensitive areas. Most of you probably think it's the clitoris, and that's it. But it's not. There's the body of the clitoris. But attached to the body of the clitoris, you have what is called the crus of the clitoris, and it comes out as a V-shaped structure. And then you also have the bulbs of the vestibule. See how they're sort of out here, sort of on either side of the labia minora. Some say those are sort of defining the opening of the vagina. Some have said they're not associated with that opening at all. So they're just in this vicinity. And the crus of the clitoris and the bulb, and some call that the bulb of the clitoris, the crus, and the bulb are all erectile tissue. And these are going to be homologous. They're not synonymous, they're not the same, but since they're the same tissue, they're homologous with the columns of erectile tissue in the male penis. And so these are going to engorge during arousal. And then the gland down here at the base of the bulb, those are going to be secretory, and they're going to make a mucus secretion that is going to be active during sexual intercourse. So there's a lot more stuff down there than a lot of people thought. And it seems like more and more with the science and the evidence that we're beginning to see, you would think we know everything there is to know about the human body, but we don't. I think they found a ligament in the knee 5 years ago that was never identified before. How is that possible?
Sometimes I think it's just made up stuff.
Sometimes they make up stuff just to get publications. How they might. And then lastly, the female genitalia, since we've got the opening of the urethra, that's where we're going to remove urine from the body. All right?